So, you're thinking about starting a family. That is one of the most exciting decisions ever. And, to give yourself and your future baby the absolute best start, a little preparation goes a long, long way. Think of this as your playbook, a super clear, step-by-step guide based on trusted medical advice to get you ready for a healthy pregnancy.
It's a journey that's filled with so much excitement, but also, let's be real, a lot of questions. Being well-informed is honestly the first and most powerful step you can take. So let's walk through exactly what you need to know together.
Okay, first things first, let's just take a deep breath. Because while there's a lot to consider, and we are going to cover it all, the vast majority of pregnancies go really smoothly. Our goal today is just to give you the knowledge and the confidence to make your journey as healthy and happy as possible.
We've set this up as a really clear roadmap with 5 main stages. We're going to kick things off with that crucial prep phase, then build a foundation with healthy lifestyle choices. After that, we'll get into the essential medical checks, learn how to protect yourself with food safety, and then we'll look ahead to those 9 months of care. So, let's jump in at the beginning.
Section 1. Setting the stage. It's a simple truth, but it's totally backed by science. A healthy body is the best possible environment for a new life to begin. And that's why this whole preparation phase it's absolutely key.
The very first thing to remember is to just be patient with yourselves. It is completely normal for conception to take a little while. For most healthy couples, it happens sometime within that first year. Things like being over 35 or smoking can stretch out that timeline a bit. So just think of patience and persistence as your first 2 tools for this journey.
Okay, so now that we've got our expectations set on timing, let's focus on what you can actively do to prepare your body. And that brings us right to Section 2, your healthy lifestyle blueprint. These are the powerful choices that really build that strong foundation for pregnancy.
I love how this slide just boils it down so simply into 2 clear actions: start and stop. On the start list, you've got things like folic acid, a balanced diet, and regular exercise. And just as important, on the stop list, you have smoking, alcohol, and recreational drugs, plus cutting back on caffeine. Let's dig into a couple of these a little more. Let's really zoom in on folic acid for a second because its impact is, well, it's profound. This one simple supplement is absolutely crucial for the baby's early development. We're talking about the formation of the brain and spinal cord. Taking it every day, starting at least a month before you even conceive, and then through that first trimester dramatically cuts the risk of serious birth defects. It's one of the easiest and most powerful preventative steps you can possibly take.
This visual makes building a healthy diet feel so much simpler, right? Think of it like a pyramid for your plate, loaded up most with fruits, veggies, and whole grains. Then add a moderate amount of things like dairy and lean protein, and then use things like sugar and refined carbs the least. It's not about a strict diet, it's just about a balanced, nourishing approach.
With your lifestyle in check, it is time for Section 3, the pre-pregnancy health audit. This is all about getting your medical ducks in a row before you start trying, so you can move forward with total peace of mind.
So, your doctor is probably going to recommend a few simple blood tests. The main reason for this is to check if you're immune to infections like rubella and chickenpox. See, catching these when you're in the early stages of pregnancy can be really harmful to the baby, so knowing your immunity status beforehand is just a critical safety check.
Okay, now this is a really important number to remember. If your tests show you're not immune to rubella or varicella and you need to get a vaccine, it is vital that you wait 3 full months after that shot before you try to get pregnant. This just makes sure the live vaccine is completely out of your system.
Another key piece of info you'll want to have is your blood type, and specifically something called the Rh factor. It's basically just a protein on your red blood cells. But here's why it matters. If an Rh-negative mom is carrying an Rh-positive baby, their systems can be incompatible. It's a totally manageable situation with medical care, but knowing both partners' status ahead of time is a huge advantage.
All right, now for one of the most practical sections, food safety. A really fascinating thing happens when you're pregnant. Your immune system naturally lowers its guard a little bit. This makes you more susceptible to certain infections from food, which is why being extra careful is so important for protecting your baby.
So, the first big one to be aware of is listeria. Now, the tricky thing about this infection is that in an adult, it might just feel like a mild flu. But for a developing fetus, it can be incredibly dangerous. It's a perfect example of why pregnancy just requires a different level of caution.
So how do you avoid it? This slide is basically your playbook. It means steering clear of things like soft cheeses, pâté, and cold deli meats for a while. The core rules are pretty simple. Wash your veggies carefully, Cook animal products all the way through and always reheat leftovers until they are steaming hot.
The other major infection to know about is toxoplasmosis. You might have heard about this one in relation to cat litter, but you can also get it from undercooked meat. And the reason we take it so seriously is the risk. If it's contracted during pregnancy, the consequences can be devastating.
So the crucial thing here is prevention. This is exactly why you hear the advice for pregnant women to get someone else to clean the cat litter box. It also means you should wear gloves when you're gardening and be extra thorough about washing your hands after you handle any raw meat. Simple steps, big protection.
And finally, once all your preparation pays off and you are pregnant, the focus shifts to our fifth and final section, navigating those 9 months. This is where consistent medical care becomes your most powerful tool for a healthy journey.
This timeline shows you how your schedule of care will kind of evolve. You'll start out with visits every 4 to 6 weeks, but as you get further along and the baby develops more, those visits become more frequent, ramping all the way up to weekly in that final month. This lets your medical team keep a closer eye on both of you as you get closer to delivery. So what are they actually checking for? Well, at each visit, they're monitoring all the key health indicators, things like your blood pressure, your urine, and of course, the baby's growth and heartbeat. These regular checks are so important because they can catch potential issues like gestational diabetes or preeclampsia early on when they're most treatable.
And that really brings us to the key takeaway here. Going to all of your scheduled checkups is the absolute best form of preventative medicine you have during pregnancy. It's all about working in partnership with your medical team to prevent issues and catch things early.
Okay, let's bring it all home. This is your core playbook, your checkpoint summary. The absolute non-negotiables are stopping smoking and drinking, taking your folic acid, focusing on a healthy diet, making sure you're immunized, and staying active. And that last point, considering your genetic history, that's a really important conversation to have with your doctor to make your care plan even more personalized.
Whew! We have covered a ton of ground, from diet and medical checks to big lifestyle changes. So the question I want to leave you with is this. Looking at everything we just talked about, what is the very first, most manageable step you are going to take on your journey starting today?